Hi, my name is Sam Schilling, and I'll be sharing findings from a project that focused on the characterization of Addenda in pediatric radiology. In 2014, approximately 1 billion imaging exams were performed globally in the adult population, and this number has likely risen since then. Errors made during radiologic interpretation are well documented, and taking a pooled error rate of 2.5% translates to about 25 million significant yearly errors. In the US, it's believed that these radiologic errors contribute to an estimated 1 in 20 outpatient adults experiencing a diagnostic error. These errors raise a significant concern for achieving high-quality patient care given their potential to delay diagnosis and treatment. Additionally, they can lead to the performance of unwarranted follow-up imaging studies, and in rare cases can result in unnecessary surgical intervention. That said, there's relatively limited data on radiologic errors in the pediatric population, and a better understanding of why these errors occur may allow us to potentially address their underlying causes. With that, the objectives of this retrospective study were to characterize and quantify the types of addenda that occur across the entire radiology department, and utilize addenda made to diagnostic radiology reports to identify and analyze implicitly acknowledged errors at a single pediatric medical center over a 10-year study period. All pediatric radiology reports containing at least one addendum generated between January 2010 and December 2020 were retrospectively identified, which totaled about 21,000 reports of almost 2.3 million reports collected over 10 years. Then, randomized subsets of addenda from 2010 to 2011 and 2016 to 2020 were reviewed and classified according to error type. The classification of each addendum into 8 major categories was made according to a modified version of a previously described schema, which included overread, underread, good communication, poor communication, post-processing, poor technique, insufficient history, and additional information. It's important to note that not all addenda are errors, so we considered an error to be an addendum that fell within the overread, underread, and poor communication categories. Over the 10-year study period, we saw an institutional addenda rate of less than 1%. We also saw an overall downward trend of both the frequency and percentage of reports requiring at least one addendum, with 1.35% of all 2010 reports addended compared to 0.8% in 2020. However, despite the downward trend in overall addenda rate, the percentage of addenda that were created in response to an error increased from 60% in 2010 to 79% in 2020. In summary, we saw a similar institutional addenda frequency rate compared to past studies that utilize comparable methodology, and we also saw an increase in the frequency of addenda created as a result of overread, underread, and poor communication over the prior decade. Continued work can help to potentially identify factors associated with errors in pediatric radiology reports in order to provide insight into improving resource allocation and best practices, with the ultimate goal of minimizing patient harm. Thanks for listening.